The Immunization Partnership started as the Houston Harris County Immunization Registry, which was founded by Dr. Ralph Feigin back in the early 90s, is a way to address the measles epidemic. He was finding that he could not figure out if children were immunized or not, and so he started a registry which helped consolidate shot records. By 2008, the immunization registry had helped to raise the immunization rates in Houston from about 55% up into the upper 70s, about 78%. And so the registry transitioned over to the state. It was at that point that the board decided to revisit our mission and vision and to broaden our impact, and so we became the Immunization Partnership. The Immunization Partnership seeks to eradicate vaccine-preventable diseases by educating our community, advocating for evidence-based laws and policy, and supporting immunization best practices. Under education, we help to educate providers as well as the general public. In advocacy, we work in Austin to make sure that lawmakers have evidence-based information on which to base laws and policies. And under supporting best practices, we help community clinics get their immunization rates up and sustain high immunization rates. Well, first, I think it's the dedication of our staff and board. I mean, we really care about the community and what happens. But I also think that the fact that everything we do is evidence-based really helps to give us credibility and helps to give us a high rate of success at everything that we do. I think the Immunization Partnership has been successful because we really believe that in order to achieve and sustain high immunization rates, it needs to be collective action on the part of the entire community. So everything we do is in partnership with other organizations that also care about immunizations and preventive health care. It's in our name, the Immunization Partnerships. We really believe in working collaboratively with the community. The second thing that makes us successful is that everything we do is evidence-based. We know that the programs that we've got out there in the clinics are successful because there's been empirical evidence that demonstrates that. We know that the messages we send through our education programs are based in science and fact. And that makes us credible and that makes us a reliable resource for anybody in the community. All of our programs have a lot of planning and evaluation that happen before we ever start the program. And so we have different metrics for each program. For instance, in our clinic-based Immunization Champions program, we measure the immunization rate before we start and the immunization rate at the end of the program. And usually that immunization rate has risen dramatically, sometimes as much as 50 percentage points. In our education programs, we measure people's attitudes and knowledge before we start our intervention, and then we measure it again afterwards, and so we know we're having an impact. In advocacy, we look at the laws, we look at how many people we've impacted, and we make sure that those laws support good immunization law and policy. There are two primary areas that are commonly misinterpreted. The first one is that people believe because of our name that we give immunizations. And we don't actually give immunizations. We believe that that should happen in a medical home. And so we do everything behind the scenes to make sure that when a person walks into an immunization clinic or a doctor's office, all of the elements are there. There's good systems in place, they're educated, and there's laws and policies to support giving that vaccine that day. So that's the first misinterpretation. The second one is that we must be funded by the pharmaceutical companies because we do so much to promote vaccines, and that is absolutely not true. We do not take a dime of pharmaceutical money or industry money because we believe it helps us maintain our credibility with the community, that we are not selling vaccines, we're not pushing them for any kind of financial profit. We're doing it because it's the right thing to do. The Immunization Partnership is so proud to have many major accomplishments. First of all, we have passed numerous evidence-based laws and policies that's going to help protect Texas and really the rest of the country from vaccine-preventable diseases. Another major accomplishment of the Immunization Partnership is in our Immunization Champions program. We have been able to raise the rates in community clinics as much as 50 percentage points, and this really makes a difference to helping protect all of Texas and anywhere that those children go from vaccine-preventable diseases. But really, our biggest and proudest accomplishment is the impact we have with our stakeholders, doctors, nurses, providers, school nurses, families, all the people who are affected by vaccine-preventable diseases. We give them a voice, and we let them know that what they do every day makes a difference. We have been continually challenged by the anti-vaccine movement. It is becoming more powerful and more prevalent to choose not to immunize your children or to delay vaccines. And both of these choices are really dangerous. As parents, of course, we all want to do the best thing for our child. And it can be really confusing and hard to figure out what's the right information and what's the misinformation. And so we like to help parents understand what information is reliable. And we always tell parents, check with your doctor. Your doctor should be your first stop for reliable science and evidence-based information about the safety of vaccines. With additional resources, we could spread our message to so many more people. We would love to be able to expand geographically and open some offices in different cities. We've had invitations from other places to come and bring our full suite of projects to different cities, and that would be really exciting for us. We would also like to expand some of our projects. We would like to reach larger audiences, do more education, do more advocacy, and really expand our reach. There are many gaps that the Immunization Partnership could fill. For one thing, adult immunizations presents nearly endless opportunities for us to provide education. Many adults don't realize that immunizations are not just for children. We need vaccines too. And so we'd love to be able to expand our programming to educate a lot of adults about the importance of immunization. The other gap that we could fill is with our advocacy, our evidence-based advocacy. Many states would love to have some resources on how to do evidence-based advocacy. And this is an area where TIP has had great success. We'd love to be able to share some resources and help other states do evidence-based advocacy around immunization, just like we've done here in Texas.